All right. Well, while you're traveling, make sure to pack the sunscreen. For so many of us, we do try to put on that sunscreen and be good about sunburn prevention. But sometimes that burn still sneaks through a little bit. 9 Health expert Dr. Payal Kohli tells us what to do after that sunburn. And go Bruins. Dr. Kohli, it's great to have you back here in studio. Okay, so the sun has been shining in Denver. It's been really hot these past few weeks. I want to talk to you about sunburn because we've talked about prevention before, but I really want to talk about what medically happens to our skin after we get burned, because it happens to all of us.
You know, I'm so glad that you asked, and I even want to talk about tanning, because we see a tan on somebody, we think it's beautiful.
Right.
And it does look nice, but actually what's happening to the skin is an injury pattern. So there's a spectrum. You have tan, you have a first-degree sunburn, and then you have a second-degree sunburn. And all of those actually represent injury. Now, depending on which layer of cells is involved, that determines the extent of injury. So when you have a sunburn, you have injured your skin cells.
Okay.
And some of that could actually mean permanent damage. In fact, having a sunburn can increase your risk for aging, age-related spots, wrinkles, but it can also increase your risk for precancerous and cancerous lesions because those cells got damaged.
Yeah.
And then when they replicate in the future, they could replicate with errors, and that's how cancer develops.
Wow. Okay. So yeah, obviously something that we need to keep in mind and we need to look out for when it comes to sunburn. I know a lot of us have heard about different treatments and things you can do. I know there have been like crazy kitchen sink remedies that I've heard. What is the best remedy for sunburn?
So the American Academy of Dermatology actually says less is more. So what you want to do is actually just take cool showers, and even multiple times a day. And when you're patting your skin dry, leave little drops of water on the skin. Okay, because that helps the moisture. And when you have a sunburn, you're using up a lot of moisture in the skin to help with the inflammation and the healing. Okay. Then you want to put some kind of a moisturizer or aloe onto the skin. What you don't want to use are those lidocaines, because you might have pain, and you may go and get a cream and put lidocaine there, which could actually irritate the skin further. Okay. If it's really bad, you may want to use a light layer of cortisone cream, a very low percentage cortisone, but don't use it on your face without checking with your dermatologist. And then you want to make sure to keep it all covered up with kind of loosely fitting clothing, but something that's really tightly woven so that you're not exposing it to further sun when you go outside. So when you hold up your clothing to the light, Danny, you should not be able to see the light through it. Okay. And that's the kind of clothing you want to wear over your sunburn.
Okay, that's great to know too. I think a lot of us too, I mean, I don't know about you guys at home, but when I see myself peeling a little bit, I'm always like, oh, maybe I should exfoliate all that. What do we do when we peel?
Not at all. So peeling and blistering are signs of a more severe sunburn. Okay. Blisters are second degree, so the last thing you want to do is pop those blisters, as tempting as that is, because what it's going to do is increase your risk of infection. You've actually burned the skin, the protective layer is sloughing off, so you just want to allow it, actually protect it and allow it to sort of heal. You can drink a lot of water, because that does help with kind of helping the sloughing process and help the hydration to come back.
Okay, good to know. Well, before I let you go, Dr. Kohli, I have to ask too, I've noticed after especially more severe sunburns that I've gotten before, maybe there will be pigmentation changes in the skin or things that we should be looking out for. Are there things that we should try to notice if we've gotten severe sunburns?
Yeah, I think that area is going to age prematurely. Okay. It might have color changes, as you pointed out, and it's really a good idea to keep an eye on that area, especially if it's a sun-exposed area, like somewhere on your face, your scalp, the back of your neck, or your chest, to looking for any kind of moles that might develop, Danny. Because you've just accelerated that process of exposure to the sun by sloughing off that top layer. And so you want to make sure you keep an eye out for any lesions that could look concerning or might change in nature or characteristics.
Okay, well, as we're enjoying those last few days of summer, great tips to keep in mind. Dr. Kohli, thank you so much. Well, if you have a topic or question for Dr. Kohli, message us on our Facebook page. That's Colorado in Company on 9 News. Your topic may just end up on the show.